Well, what do the experts say? Virologists at the Kumasi Center for Collaborative Research is calling for stronger surveillance measures to prevent escalation of COVID-19 cases. Dr. Michael Owusu says the lifting up of the lockdown will make no impact if Ghanaians misconstrue it for relaxation of surveillance protocols. He tells my colleague Ohim Interior of our health desk, security operatives should be maintained on the ground for continued enforcement of preventive measures.
The approach we are using is okay, and is what we call the heavy restriction and flexible approach, or what others will call it the dance and then the hammer approach. So in the hammer approach, you look out for hotspots, you move in strongly and put in all your interventions. You do active testing, contact tracing, searching for the people, isolating them, containing and treatment, which is what we have done over the time. We have done this for 3 weeks. We understand that the prevalence of community cases is a little below 1% in both Ashanti and then also in Accra. So for me, it means that the burden of disease on the ground is quite good. And all the 1,042 we have, practically, I expect that the movement have been restricted, which means that they are either isolated or they are under mandatory quarantine. So they are not moving about to infect populations. For me, that is one thing we have achieved by doing this. And normally at this point, after 3 weeks of being in home under lockdown, you expect people to now go about their routine activities to regain some losses in terms of what they have lost. But then the surveillance measures will have to be stronger than before. The social distancing must be practiced more stronger than before. The hygienic practices must be more stronger than before. So your measures in terms of what you put on the ground before you ease restriction has to be even much more stronger than what was done before. So theoretically, yes, it's good. But the surveillance measures and all the precautions is what we have to ensure that people adhere to. Else, people go by their normal duties and relax these measures. My fear is that we may begin to have an increase in cases coming up.
When are we likely to hit that stage?
It depends largely on the behavior of us citizens and also the policy directions of government. For instance, from the statements the president made, I think that there need to be more clarification from the information ministry. The first is that I don't expect nose masks to be encouraged. I expect nose masks to be mandatory, that everywhere anybody goes, before you go to a trotro, a public transport, every gathering you go, the first thing is that you must be in a nose mask, and the police must ensure that whoever goes out has a nose mask.
Mandatory wearing of nose masks, he says. Dr. Owusu, who is also a lecturer at the Department of Medical Diagnostics at KNUST, wants all Ghanaians to be compelled, like you heard him, to wear face masks. He says strict enforcement and compliance are key to winning this fight against coronavirus.
In town, I see people moving about as if the disease is over. The disease is not over. The disease is in the system and is trying to take hold of the system. And when it gets hold of the system, then it will start knocking the susceptible people, those who are old and chronic illness, at random. And then you begin to have a spike in hospital cases. This, for me, is a very crucial moment for us, where if we don't put in good measures, we cannot do contact tracing anymore. Contact tracing will lose its relevance. Our best bet is to stay at the hospitals, waiting for people to come. And by the time you begin to get there, it will be a difficult thing for us to manage as a country. So I think that if we have to slow the spread, then we have to ensure that the social distancing and all the accompanying measures will become we have to enforce it, not to give it for people as an option and to just encourage, but to move forcefully and ensure people adhere to this. In that way, we can still succeed in slowing the spread whilst people go by the economic duties. And then I also expect that if we put in good surveillance measures, as the disease begins to rise, we should lock down as and when the disease begins to shake. I mean, people begin to have experience. We didn't think that lockdown is over. No. We can live with this for the next 6 to 12 months. So the precautions now should be more stronger even than before. And the police and the security must ensure